51. Start the training.
Start now.
Okay. Good morning. I am presenting the case of one important case, which is uh, severe hypothyroidism case. So I am presenting this patient because she is the age of 50-year female patient. She was operated case of thyroid nodules was there. So she was operated for total thyroidectomy. After total thyroidectomy, for supplement we are given eltroxin, like thyroxine supplement we are given 100 mcg per daily she used to take. Since 1 year she stopped taking thyroxine tablets. So this, as she is not having any thyroid glands to produce some thyroid hormones, so she is in the severely deficiency of thyroid hormones. So how can we assess? She came to hospital complaining of just her complaints were only difficulty in speaking. Means she is not having speaking like her talking is like if I ask any questions which is your place, if it is a Gataprabha, she is everyone will say that my place is from Gataprabha, but she is telling that my place is Gataprabha. So this much slow speech she is telling, like this is one of the sign of severe hypothyroidism. And next complaint is she is having numbness of the right, like the body, generalized body, more towards the right side. So in hypothyroidism there is something called neuropathies conditions. In patient of hypothyroidism they will present with severely numbness of the limbs and other neuropathy signs. And one more is generalized weakness is there. She is complaining of lethargy, fatigue, weakness, and sometimes she is complaining giddiness and abdominal pain. And by this complaint she came to hospital, and we dig on his history. As the history shows that she was operated for total thyroidectomy, and she was been advised for the eltroxin tablet, and she skipped this tablet since 1 year. So because of this, she developed all signs of severe hypothyroidism. And by looking, there is something called as signs and symptoms. So for this patient, by only seeing the signs suggested of hypothyroidism, first by seeing you can see her you can see her torch, see her skins. So this is a like too much dry, harsh and coarse skin. You can see that it is like a fish. It's like a fish. It's looking like a fish, and this is a dry skin. This is this is one of the best sign of what you called hypothyroidism. See this dry skin. You can clearly make out this dry skin now. And her one more condition is she is having a hair loss, dry hairs. You can see the hair color now. It is a dry coarse hairs with the loss of patchy hair loss is there here. So these two are the first by seeing we will confirm to see this patient. After that she was having, there is something called, what are the signs? She used to have bradycardia. There are the reduced or the diminished reflex of the deep tendon reflexes, and bradycardia diminished and hypothermia, cold intolerance. These all come under the features of hypothyroidism. So she is having cold intolerance also there, and now we'll examine for her deep tendon reflexes whether these are the normal or any exaggerated or reduced, means diminished reflexes. Now in this patient, as clinically she should have some diminished deep tendon reflexes. So I will examine now. काल सैडल बिड़ आराम से बिड़ ಏನು ಮಾಡೋದು. See, there is no any like mild slight is there, like totally absent, but you can call this as a diminished because he is having fluttering here. So for this here also loose battery. Now this is also totally reduced. So this is one sign you found, and her pulse rate, by examining her pulse rate is only 60. So she is having bradycardia, she is having diminished deep tendon reflexes, she is having coarse and harsh dry skin, and she is having patchy hair loss with this, you can see this dry like harsh hairs. And one more thing is she should have some voice change. ಧ್ವನಿ ಚೇಂಜ್ ಆಗಿತ್ತಲ್ಲ ನಿಮ್ಗೆ. By we first visit only we can't judge her voice, but she is giving history of voice change. So these all the signs will give the clues of severe hypothyroidism. For this treatment is first we have to see the level of TF, total thyroid stimulating hormone. So we have to send test of TFT test. After TFT report, we have to plan to start the redox interval, whether 50 mg have to start or 100 mg, 150 mg. Depending on that TFT report, we have to start. Thank you.